So if I want to actually tell you guys to actually guess the possible causes of hematuria, right, that's like things that can cause blood to actually appear in urine. Okay, first thing I would do as a student is like, okay, I'll look at the kidneys, all right, and I'll look at where the kidneys have the greatest what relationship with blood vessels. And what is that unit called? That's the glomeruli, okay, where you basically have blood vessels coming into the glomeruli to filter out urine. Do you understand? So it means that if anything happens here, blood can leak out and then you'll be passing out urine in blood, blood in urine, okay? But passing out blood in urine could also have other causes outside this unit. So I'll say that what causes of what this hematuria be from the glomerulus, that's glomerular causes, or it could be outside the glomerulus, that's what non-glomerular causes. Do you understand? So let's kick it up. If the problem is primarily from the glomerulus, we call it what? A glomerular hematuria. Okay? And examples of causes of this glomerular hematuria, you could have primary what? Glomerulonephritis. Now, this primary glomerulonephritis is more of like what? It's inflammation right there at the glomerulus. Okay? It could be a multi-system autoimmune disease conditions like what? The systemic lupus erythematosus. That's the SLE. It could be things like vasculitis, like there's just generalized inflammation of blood vessels and all that. Right? Examples of conditions that we have this, we have the Wegener's what? We have the Wegener's granulomatosis. We have the Chong-Strauss what? Angiitis, where basically you have inflammation of blood vessels too, right? It could be that there's an antiphospholipid syndrome too, all right? So you have other disease conditions listed down here, all right? But the most common ones are these two, right? Then it could be that there's what? Problem. But this problem is outside the glomerulus unit, where the kidneys have what? The biggest what? Relationship with blood vessels. But if it is outside the glomerulus, it could be that there's what? The problem is still within the kidney, all right? Still within the kidney, just other parts of the kidney, just that it is not the glomerulus now, right? So you still talk about renal origin, and that's why you're having problems like what? Tubulointerstitial disorder, there could be malignant hypertension, there could be renal embolism, or arterial or venous thrombosis, right? There could be infection, like pyelonephritis or tuberculosis. It could also be hereditary. There could be that there was a cancer, right? That's neoplasm, like renal cell cancer, Wilms tumor, lymphoma, and the rest, okay? It could be that there was a primary necrosis, which could result from things like what? Diabetes mellitus, sickle cell anemia, and analgesics, right? Then it could be that this bleeding was outside the kidney, okay, but was what? Inside the urinary tract, okay? That's the urethra down, okay? It could be that there was a trauma or there was a foreign body in the urethra. It could be that there was an infection, like what? Periuteritis, okay? It could be that there's cystitis, there's prostatitis, okay? That's inflammation of the prostate, okay? There could be as a result of cancer, that's neoplasia, you have things like carcinoma of the bladder or prostate, okay? It could be that there's a calculi, that's basically how like there's deposition of what? All those stones, all those calcium and all those stuff, right? So you can see that there was deposition of calcium oxalate or phosphate stones, all right? Then it could be that there was some vascular malformations. It could be that there's urinary obstructions or relief of obstruction, okay? Then it could be that the cause of this blood in urine was from other sources, right? Like if the person just has a general coagulation disorder, like in generally the person cannot be able to what? Clot blood properly. So basically there's internal bleeding, and this internal bleeding leaked into the urinary tract, and that went on. It could be that there's acquired cystic disease of what? Renal failure. Okay, that's it about the possible causes of hematuria. Subdivided into what? The ones that could be from the glomerular, which is basically the most common, right? There could be that there are some that are basically what? Outside the glomerular, right? The ones outside the glomerular will also still subdivided them. So that's it.